Hey guys, Christina Hoffey is here for Pathophysiology doing my student report on hydrocephalus. So your body is made up approximately of 70% water. Well, your brain is no different. The fluid in your brain or around your brain is cerebrospinal fluid, which is the fluid that runs up around your brain and down your spinal column. Now, this fluid helps to cushion the brain and bring nutrients to the brain. If you have hydrocephalus, this is considered water on the brain. It's fluid that does not flow or get absorbed in any manner. It can lead to blockages and puts a lot of pressure onto your brain. Hydrocephalus happens mostly in infants or adults over 60, but you can actually get it at any age. There is no cure for it, but there are different treatments that you can use for hydrocephalus. There are different symptoms just depending on your age. In babies, they include an unusually large head that gets much bigger very quickly. The soft spot on the top of the baby's head is firm or bulging rather than being a soft spot. Eyes that focus downward, sometimes they call it sunsetting, where there's so much pressure behind the eyes that it pushes down. Crankiness, which how many babies are not cranky? Then there could also be vomiting and poor appetite. In toddlers and young adults, you can see a lot of headaches, blurry vision, again with the larger head, sleepiness or low energy, a bad balance or coordination, some associated with vertigo, loss of appetite, seizures, crankiness or change in mood, trouble doing well in school, having a hard time concentrating. Now for the adults 60 and older, they may pee more frequently or lose bladder control, have memory loss, trouble with planning or processing skills, and have problems walking or a poor coordination. There are three main causes of hydrocephalus. It could be a blockage, poor fluid absorption, or too much fluid. Now, a blockage could be tumors, cysts, birth defects, or other objects in the brain that could block or affect the normal flow of the cerebral spinal fluid. Poor fluid absorption could be inflammation, injuries, or injections like bacterial meningitis. So if you get a spinal tap and it was any kind of bacterial infection, could have gotten in there. It can keep your brain tissues from taking in the cerebral spinal fluid. Now, too much fluid, this is really rare, but your body makes more cerebral spinal fluid than your brain can actually handle. So there's actually four main types of hydrocephalus. There's congenital hydrocephalus, which is when somebody is born with the hydrocephalus. The compensated hydrocephalus. This shows up early in life, sometimes before birth, but doesn't cause symptoms until later in life. The acquired hydrocephalus, this is caused by a tumor, cyst, head injury, or a brain infection, which could result in from a spinal tap that was not properly cleaned. Normal pressure hydrocephalus. This usually shows up in older adults, and it can lead to swelling in a small open areas of the brain without any changes in pressure. Doctors aren't really sure what causes this. Now, something I heard was that football players who have had lots of brain injuries have had a form of hydrocephalus from the impact of the brain rocking back and forth is causing cerebral spinal fluid to leak, and those also cause extremely bad migraines. So for diagnoses, your doctor will start you with like a physical examination and ask you about your symptoms. They'll normally get to imaging tests to look for signs of hydrocephalus. This test could be an MRI that can scan images of your brain. It takes like slices of your brain so that you can see each different lobe of the brain. Another thing they could do is a CT scan, which is a series of x-rays taken from different angles that they put together to make a more complete picture. Getting into treatments. If your symptoms are mild, you may not need treatment. If they're serious, your doctor will probably recommend surgery to put little plastic tubes called shunts into your brain that redirects the cerebrospinal fluid into another part of your body, like your belly. The shunt typically isn't ever removed, and regular checkups are important to make sure that they're working properly. In some cases of hydrocephalus, it can be treated without using a shunt. One type of surgery opens a pathway into your brain so that the fluid can flow freely, while the other closes off the part of your brain that makes the cerebrospinal fluid. Something that I found very interesting while I was doing my research for hydrocephalus is in the history books. References to hydrocephalus skulls can be found in ancient Egypt medical literature from 2500 BC to 500 AD. Hydrocephalus was described more clearly by the ancient Greek physician Hippocrates in the 4th century BC, while more accurate descriptions were given by the Roman physician Galen in the 2nd century. So basically what was happening was they were finding these skulls and they were grossly enlarged, and a lot that they had found were actually babies. So one of the cases that I had actually found on Wikipedia, I thought was very interesting. I'm going to read to you very quickly. One exceptional case of hydrocephalus was a man whose brain shrank to a thin sheet of tissue due to the buildup in the cerebrospinal fluid in his skull. As a child, the man had a shunt, but it was removed when he was 14. At age 44, he went to the hospital due to a mild weakness in his left leg. When the doctors learned of the man's medical history, they performed a CT scan and an MRI, and were astonished to see a massive enlargement of the lateral ventricles in the skull. The doctor said that the images were most unusual. The brain was virtually absent. Intelligent tests show the person had an IQ of 75, considered borderline intellectual functioning, just above what would officially consider mentally challenged. The person was a married father of 2 children, worked as a civil servant, leading an at least superficial normal life. Despite having enlarged ventricles with a decreased volume of brain tissue, what I find amazing to this day is how the brain can deal with something which you think should not be compatible with life, said the doctor. A pediatric brain defect specialist said that if something happens very slowly over quite some time, maybe over decades, the different part of the brain takes up function that would normally be done in the part that was pushed to the side. Thank you for your time, and I hope you enjoyed my presentation. Have a good day.